Today I have the privilege to announce that my office has submitted Mississippi's Rural Health Transformation Plan to CMS. It is our state's official response to the Trump administration's call for Rural Health Transformation Program proposals. The program, as a reminder, is a $50 billion initiative. It is a tremendous opportunity to make a real impact on the lives of Mississippians, particularly those living in rural communities throughout our state. While Mississippi has long faced challenges in delivering access to quality health care in rural areas, our plan is designed to address those challenges head on. The Office of the Governor will lead the oversight and coordination of the program, working closely with an all-of-government approach, specifically with the Mississippi Department of Health, which, as you know, I'm sure, houses our state Office of Rural Health, the Mississippi Division of Medicaid, and all of other state stakeholders. This includes the Mississippi Department of Health, the Mississippi Division of Medicaid, the State Office of Rural Health, the Mississippi Department of Education, the Mississippi Department of Mental Health, the Mississippi Band of Choctaw Indians, and other partners. Just to give you an idea of what's transpired over a very quick period of time. On July, first of all, the bill was passed and the President signed it into law. On July 31st, the Mississippi Division of Medicaid launched a public survey to gather input from both stakeholders and the public. The survey asked participants to identify current challenges and potential solutions to propose as part of the plan and for the use of funds. The state received over 140 responses from half of Mississippi's 82 counties. Respondents included state health officials, state legislators, public health workers, health care providers, health plan representatives, and potential vendor partners. Our team analyzed every response to identify common themes and to inform the initiatives included in the plan. After we received the survey responses, our team hosted a full-day listening forum on August the 28th with representatives from the Mississippi Department of Health, Department of Mental Health, the Mississippi Emergency Management Agency, Accelerate Mississippi, and IHL. Additionally, healthcare providers, leaders from hospital and community health associations, ambulance services, and nursing homes were also in attendance. The participants brought expert insight into Mississippi's rural health needs and potential solutions, helping the state solidify the initiatives in the plan. I'd like to personally thank everyone who participated in this effort. In addition to this, the leadership team from the Office of the Governor, the Mississippi Department of Health, the Mississippi Division of Medicaid also conducted additional discussions with rural providers, tribal leaders, and potential vendor partners outside the formal survey and forum settings. In other words, despite some of the insinuations that clearly are false made by some, the state of Mississippi has worked hard to gather as many perspectives as possible so that our plan reflects the needs of Mississippi's rural residents. We will continue to rely on input throughout implementation to ensure the initiatives remain practical, effective, and responsive to local needs. The Office of the Governor will coordinate oversight with the assistance of the Mississippi Department of Health and the Mississippi Division of Medicaid. A third-party organization will assist with deploying funds, tracking milestones, evaluating outcomes, and by the way, that is going to be a critical component. Outcomes. This is about improving the health of our citizens through measurable results and ensuring compliance and program effectiveness. Through regular communication and checkpoints with local communities, providers, and health departments, the state will ensure that program decisions reflect the realities of rural health care in our state. The Department of Health, with offices in every county, will certainly serve as a critical link between local and state leadership. And I want every Mississippian watching to know that we are committed to taking necessary state-level actions to ensure the successful implementation of the plan. The proposed plan is designed to benefit residents across the state, and it's really broken into 6 different initiatives. The 6 initiatives are as follows. First, we will enact a statewide rural health assessment. This is something that Dr. Edney has talked about for some time, and the state will engage a third party to conduct a comprehensive statewide assessment of rural healthcare needs, both today and looking forward over the next 10 years. Second, the Coordinated Regional Integrated Systems Initiative. This is designed to transform rural healthcare delivery across the state by creating a connected, data-driven network of emergency, clinical, and community-based services. Third, the Workforce Expansion Initiative. This initiative is designed to strengthen the healthcare workforce in rural areas, improving access, continuity, and quality of care. Through targeted programs, the initiative addresses recruitment, retention, training, and career pathway development for healthcare professionals. Fourth, the Health Technology Advancement and Modernization Initiative. This initiative is designed to modernize rural healthcare systems by strengthening the digital backbone that supports high-quality, coordinated, and secure care. Fifth, the Telehealth Adoption and Provider Support Initiative. This initiative is designed to strengthen rural healthcare by increasing virtual care access, supporting providers in adopting telehealth, and exploring innovative payment models. Investments will enhance connectivity, technology, and diagnostic tools to enable real-time remote care. Finally, the 6th initiative will be the Building Rural Infrastructure for Delivery, Growth, and Efficiency Initiative. This initiative is designed to strengthen rural healthcare infrastructure by improving access to specialized care, closing care gaps, and supporting innovative pilot programs that enhance healthcare delivery and, again, improve outcomes. This initiative focuses on building physical, operational, and programmatic capacity to address unmet needs, improve care coordination, and foster sustainable rural healthcare systems. The Rural Health Transformation Program is a once-in-a-generation opportunity to make a lasting impact on the health of our rural communities. And Mississippi is ready to implement the plan with accountability, with transparency, and with results-driven oversight. Every dollar invested will be focused on improving health care and patient outcomes for rural Mississippians, strengthening our rural health workforce, and ensuring sustainable access to care for the people who need it most. On behalf of the over 3 million Mississippians who live here, I want to thank everyone who helped us draft our plan, many of whom are standing here with me today. I also want to take this opportunity to personally thank President Trump, Secretary Kennedy, and Administrator Oz for the opportunity to submit this plan and for the opportunity to make meaningful and lasting change in the delivery of health care throughout Mississippi. I know that together, our plan will make a positive impact on the lives of Mississippians in rural communities throughout our state. Now, with that, I'm going to turn it over to you and let you ask questions. Here's how I would like for this to go. If initially you will focus your questions on this specific item so that my friends behind me can stay here and answer any specific questions that you may have. Once that is complete, I will let them sit down, and then I'll open the floor if there are any questions outside of this particular transformation fund. So with that, questions.
The federal program doesn't necessarily require states to discuss how the funds are being used. So how do you plan on implementing transparency?
Okay, so this is the way I would answer that. We started with a process where we brought groups from all over Mississippi together, both through their responses and through conversations. And the way I look at this is there's really kind of two boxes, and our plan has been developed with box number one over here, which is we're taking the 140 responses and the literally hundreds of conversations that we have all had for many years, and this is what the providers and others want in this box. And then we're going to take this box over here, which is sort of the box where Dr. Oz and the folks at CMS have said, this is how we really want you to focus these resources. And oh, by the way, they get to judge who gets how much money. And so we've taken these two boxes and we've tried to converge them as best we can to make sure we're meeting the needs of our people, while at the same time our application and our plan meets the stated goals that the federal government has. Just as a reminder for those of you who do not know, this is a $50 billion plan. Of that $50 billion, $25 billion is going to be split evenly between all 50 states. So everybody's going to get $500 million over 5 years. The other $25 billion is going to be allocated on basically a competitive grant situation. And so what I've told our team is we want to develop our plan, and we're going to send our plan to the feds. And our goal of the other $25 billion is to get our fair share and the fair share of 2 or 3 other states. And we think we have put together a plan that's going to do that. Now, as we progress forward, as we see what CMS does over the next really 60 days, because the statute contemplates that CMS is going to make some award by December 31 of this year. As we see what they say, then we'll be able to go from there as to exactly how we're going to spend the monies specifically. But look, we're going to be, as we move through this process, we're going to be transparent. We're going to talk about the things that we're doing. We're going to be very clear to everyone engaged and involved that we are going to require that there are measurables put in place, that there is accountability, that we can measure outcomes. Because here's the deal. We believe that while there is going to be a general award by December 31, we also think that in the out years, in years 2, 3, 4, and 5, we can use our data to improve the amount of money we get in the out years if we're good at what we're doing. And I think, and we talked to a number of groups in the last couple of days, and the way I envision this working is very similar to what's transpired in the realm of education in our state over the last 10 years, where we are going to be successful. We're going to see if we get our plan funded by the feds. We're going to see improved health outcomes. We're going to see those improved health outcomes. We're going to work with our legislature to potentially change general statutes to continue to better fund these programs. And what's going to happen, just as it has in education, just as it has in economic activity in our state, success begets success. And so if we can move in these poor outcomes from 48th or 49th or 50th to 42nd or 43rd or 44th, then we can go to the feds and show them that here are the actual programs that we funded and here are the actual results that have led to improved outcomes. Then two things are going to happen. Number one, our policymakers in the legislature are going to take note of that. They're going to be very interested in that. And our friends in the Trump administration are then going to fund the programs even more, we believe, in the out years. Yes, ma'am.
With this being the Rural Health Initiative, are there any certain areas or counties that is particularly focused on this, getting better health care and better outcomes?
So that's a good question. And what I would tell you is when you look at the definition of rural health and specifically the number of counties that would be included, I don't want to put a number on it, but I think it's fair to say in Mississippi there are a lot more counties that would be in the definition of rural than would be out of the definition of rural. And quite honestly, there are counties even in the metropolitan areas, even on the coast, even in central Mississippi, even south of Memphis in the DeSoto County area, where there may be more metropolitan cities, etc. But you know, you get southwest of Raymond in Hinds County, it's pretty daggum rural, okay? I mean, and so basically, I think what you'll see is there will be virtually every county in our state is going to be included in terms of opportunity. Now, what you see in Mississippi is that there are some models in some regions of the state where we do rural health better than in other areas, in other regions. And so some of what we'll be talking about is how do we take those systems that are in place and better fund them to treat more individuals. And then in other parts of the state, it's how do we take the current system, current model, and significantly improve upon the delivery model. Ross?
So if I'm just a mechanic in Tallahatchie County, what does this mean to me?
If you are a mechanic in Tallahatchie County, what this should mean to you is that when something happens to you and you need access to care, that there is a professional near you that can provide that care. That is the primary goal of what we're trying to do. Is, you know, I mean, there's always territorial arguments. There are always institutions who say we need this or we need that. But what we really need at its core as a state and really as a nation is we need more healthcare workers. We need more work. We need more people that can treat more people. And so if something happens to you in Tallahatchie County, we want to make sure that your ability to access the system and get whatever care you need is available to you. At the end of the day, that is the ultimate goal. And I think for some people in many parts of our state, that is accessible today. For some, it's less accessible. And part of our goal to initiate this by doing the rural health needs assessment is that we can confirm that what we think are the holes in the access delivery system are in fact the holes in that system, and that we can help find ways for individuals to enter it. Yes, ma'am.
Some rural hospitals have said they're crossing their fingers to get some direct assistance as a result of this program. It sounds like the program focuses on broader systemic changes in accordance with the federal plan. But are there specific reassurances that you can offer small rural hospitals that will help, or pillars of the plan that will help shore up their bottom line? Yeah, so there is no doubt that there are some facilities that want just a direct payment. You know, I'm sort of reminded of, I've been around a long time, and I'm reminded of, in my earlier policy days, I had a specific community college president that came to me, and we were working on a grant program for community colleges, and he was very quick to explain to me that he would much rather have $1 million with no strings attached than a $25 million program in which he had to be held accountable, right? That's human nature, and that's okay. The feds, through CMS, are not going to look favorably upon direct payments, I think. Is that fair to say? They've been very clear that that is not going to be allowable, and if states ask for that, you're going to get dinged on your plan. And so while I understand why individual facilities would like to see that, that is not at all what is envisioned by the Trump administration. That is not at all what is envisioned by Dr. Oz and the team at CMS. And just to put things in perspective, we're talking about a lot of money here. $500 million over 5 years guaranteed is a lot of money.
But let's just put it in perspective. If we only get the $500 million, that's $100 million a year. A lot of money. But our enhanced MHAP payment that goes directly to the facilities that we announced 2 years ago is $1 billion a year for these facilities. We have facilities that are getting 25, 30, 40 million dollars through the enhanced MHAP payments. And so those direct payments occur from Medicaid, but they are not likely to be part of this plan because they're not really allowable under what Dr. Oz wants. Great question. Yes, ma'am.
To follow up on that, I guess, as we're seeing those enhanced MHAP payments kind of start to be phased out beginning in 2029, are there particular elements of the plan that will prepare for that and transition hospitals away from those direct payments?
Yeah, I mean, I don't think there's any doubt that that hospitals in rural areas are going to certainly going over the next 3 to 4 years be looking at ways in which they run their business model. Look, I said to a group recently, a large group, that if you wake up every single day as the CEO of a healthcare facility, and the first 3 or 4 hours of your day consist of how do I structure or restructure my assessment with the federal government so as to try to maximize my federal government payments, you have a flawed business model, and that is only going to work for a short period of time. It is not going to work in the long term. And so there is no doubt that that facilities, because by the way, the federal government changes their mind regularly on exactly what federal regs should be and are and how entities are reimbursed. I mean, you look at some of the financial challenges, and people don't want to talk about this, but it's a fact. You look at some of the financial challenges that occur in our hospitals across the state and across America. A huge piece of that, historically, is because Medicare, which is totally federal run, has been reducing the reimbursement rates for years. Why? Because the cost of Medicare at the federal level, you may have noticed we have a $38 trillion national debt, and a big piece of that is because the federal government has, through legislation, have written checks that they can't cash. And so, yeah, I don't think there's any doubt that as the MHAP payments are, and other reimbursements, by the way, are adjusted on a regular basis, every facility in our state is going to have to continue to think through what exactly their business model looks like. And hopefully that will lead to some efficiencies as well. But I think what this plan is going to do, as much as anything, is it's going to help, and we've already seen it, and I'll let Dr. Edney talk to this too. We've already seen it, is it's going to facilitate collaboration amongst entities perhaps that always viewed themselves as competitors, but now realize that they're going to have to work together not only for the greater good, but they're going to have to work together because that's the best way for them to deliver care, but also the best way for them to stay in business. So, Dr. Edney, you want to talk to that a little bit?
Thank you, Governor. And it is an amazing thing to see where 3 years ago we weren't seeing it at all outside of an equity model, meaning larger hospitals buying smaller hospitals and forming equity systems. But now we're seeing organic collaboratives happening without the equity model, where they have shared services, shared professionals, shared overhead, and we're seeing great success with that, and beginning to see it in the Mississippi Delta where it's critically important. And then, but understand that the rural hospitals are going to receive a lot of funding. It's just with deliverables and funding to help improve outcomes for our rural areas. And the governor is so right. This is about improved outcomes. This is not about just spending a lot of federal money. Outcomes are everything. And as the outcomes in our rural counties begin to improve, then outcomes for the state will continue to improve. And as we improve rural health care, we improve all health care in the state. So these collaborative efforts are really important.
Thank you.
Can you share more about how you'll encourage those through the plan? Sorry, the collaboration between health systems.
Yeah, look, I think what's going to happen is as we set up these various pilot programs, again, we've got everything that we have asked has to be approved by CMS. And so assuming they approved the plan as it's written, and they love it, and they give us more than our allocated $500 million over 5 years, many of the specific programs that will ultimately be created, which are yet to be finalized, but many of those programs are going to be put in place such that they encourage, they incentivize those collaborations. And so I think you see, as an example, just one example that I think Dr. Oz has basically said one of his, if not his number one priority, one of his top priorities is a health information exchange. And the reason that's important from my layman's perspective is that if you're a patient in Cleveland and you have a difficult situation and you end up in Jackson, if the physician that is treating you in Jackson or Tupelo or Gulfport, maybe you're on vacation, if they don't have access to your health records and they don't know exactly what you have been treated for in the past, the likelihood you get the best care possible is pretty slim, because the physician treating you may be the best physician in the world, but they don't have all the facts. And so that's why health information exchange is extremely important. That's why you heard me talk about one of our initiatives is the Technology Advancement and Modernization Initiative. This is going to be the potential so that we can help smaller facilities, more rural facilities participate in a exchange where every treating physician can have access to information that they need to best treat the patient so that our outcomes can improve. You want to speak to that, or you good? You did. I've learned a lot through the last 60-day sprint that we have been through, and it has been a sprint. And I've said it a couple of times, but I'm going to say it again. Everybody up here behind me, all of their staffs and teams, and my team at the governor's office have just done yeoman's work, and both in terms of listening, in terms of working, and I really do believe in talking to some of my friends from around the country and listening to their stories who have talked to their friends around the country. We've made real progress, and I think we're further along in this process than many states. You've noticed last week, as an example, that I did a couple of things, including reinstituting the presidential fitness test via executive order. We're going to get points for that when the folks at CMS judge our proposal. I also asked for 2 SNAP waivers last week. We're going to get points for those, and I think that's again part of our goal and part of our initiative to get our fair share and get the fair share of a couple other states that maybe didn't do some of these things. So at this time, I'm going to ask all these folks to sit down. Thank you all very much. Awesome job. And one of the things that you saw, that I hope you saw, is this is truly a whole of government approach. Some of these people that were behind me work for me and report to me and were chosen by me, and a lot of them don't. And that's okay. And what's happened is everybody has been on the same page and rowing in the same direction. And for that, I am very grateful. And I think that's one of the reasons that we probably have a proposal that's going to be viewed very favorably by those in HHS and CMS. So at this point, we can stop with this and answer any other questions that you may have. Yes, ma'am.
Going back to the SNAP waivers, why are you applying for these waivers right now for the processed foods to be banned from the SNAP benefits, buying them? Why are you doing this right now in the midst of uncertainty looming over whether or not people will even get their SNAP benefits for the month of November?
Yeah, so the reason that we're doing it now As you know, 12 other states have done it, most of whom have done it over the last 60 to 90 days. We went through a process in which we worked with a large number of individuals, a large number of groups as to exactly what we think that ought to work towards, what it ought to look like. I had a meeting, extensive conversations with HHS Secretary Kennedy back in August, and we had very good conversations on exactly what he envisioned in terms of Make America Healthy Again. They made it clear at HHS and at CMS that those states that were also interested in making America healthy again would be viewed favorably in the scoring of these reports. And it's just the right thing to do. It just makes sense. And we're very, a lot of these things Dr. Edney's been talking about for a number of days or weeks or months or maybe even years. And so, you know, we've been working on this for quite some time. In terms of your specific question, which is with respect to the uncertainty surrounding SNAP, look, I think the uncertainty surrounding SNAP is a disaster, and it is ridiculous. It is awful, and it is a direct result of the Schumer shutdown. You may know, even today, 55 members of the United States Senate voted to open the government. Unfortunately, it takes 60. Of the 55 members who voted to open the government today in the Senate, and by the way, so the SNAP problem could have been resolved a couple hours ago. 52 Republican senators voted aye to open the government. 45-ish Democrats voted no. It's unconscionable to me that they decide to play politics, and you've got a lot of government workers that aren't getting paid in the federal government. You got a lot of uncertainty amongst individuals that already have challenges in their life, and so I think it's awful. But I'm hopeful that once we get this election over, we have elections today, as you know, in New York City. It's evidently very important to the National Democrat Party that they elect a socialist mayor of New York City, and I think that's a big reason why Schumer has kept the government shut down, is to help their candidate in the city. It's sad. It's why they're playing politics. I don't know, but that's what they've decided to do, and I think that's terribly unfortunate. I should, since I mentioned elections, we have some elections here in Mississippi today as well. There's some state house races. There's some state senate races, and so if you're watching and you haven't gone to vote, I had my sticker on. It fell off, or it's upstairs. I voted today in Hinds County. We did not have a senate race in my district. We just simply had a coroner's race. But if you do have a state senate race, if you do have a state house race, I strongly encourage you to get out and vote before 7 p.m. today. So, yes, ma'am.
There are neighboring states like Louisiana, for example, where Governor Jeff Landry issued emergency funding to extend these SNAP benefits. Could we see something like that here in the state, or are you planning to do something like that?
Yeah, so if you look in Mississippi, and I referenced this via social media not so long ago, every state is set up a little bit differently. Mississippi's emergency powers give me the ability to suspend statutes, give me the ability to suspend regulations, give me the ability to do things like what we had to do during the pandemic. But what Mississippi's emergency statutes don't do is they don't allow me to just spend money, just appropriate money. And so while the governor in Louisiana certainly has that authority, evidently, the governor of Mississippi doesn't have that authority. And so that's why it is so important to our people that are dependent upon SNAP, that the government gets back open, that the Democrats in Washington vote to reopen the government, quite frankly, to take the exact same vote to open the government that they took not once, not twice, but 13 times during the Biden administration. They voted for a CR, and it's important that they do so now. But if you are dependent upon SNAP, I would encourage you to call Congressman Thompson ask him to encourage the Democrat senators in Washington to reopen the government. Yes, ma'am.
Last week there was a hearing in front of the Black Legislative Caucus about the infant mortality crisis, but particularly about the maternal health crisis. And I just wanted to know if you had comment on that, particularly with the fact that it's occurring in such rural environments and affecting predominantly Black infants and Black mothers.
Yeah, I don't know anything about that legislative hearing, so I don't know that I could make a specific comment on that. But I will talk in general terms, and Dr. Edney, to his credit, has done a fantastic job bringing this issue to the forefront. It is a major challenge. It is one that we have to do everything we can to ensure that more people, particularly in the Mississippi Delta, have access to labor and delivery units, et cetera. And I think you'll look at as we go forward with these federal funds, there'll be serious conversations around what can we do as a state to make it easier for individuals, particularly in the Delta, to get to a labor and delivery unit. We also have to recognize that government can't solve all of our healthcare challenges. A lot of our healthcare challenges in Mississippi and across America are driven by individual choices, and so we need to do a better job educating our people and with the risk that come with pregnancy and other things. And I'm certainly hopeful that we can utilize this group of funds along with some of the conversations that have been ongoing both with policymakers in the legislature and in the executive branch to try to put a major dent in those very, very poor statistics that we have. Because what we know is, while they are numbers on a page and they are statistics, they're also lives and they're people, and lives and people that we care about and that we want to help to the extent possible. Yes, ma'am.
Governor, as you know, the holiday season is approaching. A lot of Mississippians are leaning on food banks and other resources as this government shutdown continues. Is there anything that you are planning to do to help these food banks and help with resources for our communities that Mississippians can pay?
Yeah, so we want to encourage our fellow Mississippians to continue to give to food banks, to continue to help our neighbors. You know, I always think when you look at a lot of these programs that are run by government is really not particularly good at running most of these programs. Government is very inefficient. We need more of our churches engaged and involved. But look, I'm hopeful that as we move towards the holidays, I am very hopeful that the Democrats are going to get beyond this election today in New York City, and that they're going to come to their senses and they're going to vote to reopen the government really soon. And I'm hopeful that once they do that, it's still going to take days, if not weeks, to get the SNAP benefits loaded onto cards. But I'm hopeful that is done long before the actual holidays themselves. Yes, ma'am.
One of the issues on the table with the shutdown are the expiration of the enhanced premium tax credits for marketplace insurance, and estimates are showing that Mississippi will be one of the hardest hit states, and hundreds of thousands of people will go without insurance next year. Was that a consideration in the rural health plan? And do you have concerns about how that will impact both people in Mississippi and hospitals? Yeah,
while the National Democrat Party has attempted to tie these two issues together, they of course have nothing to do with one another. The shutdown has absolutely nothing to do with the subsidies of the Affordable Care Act expiring. In fact, the subsidies in the Affordable Care Act are expiring because in a bill that passed the Congress 2 years ago with 100% Democrat support, the subsidies were added for the pandemic. They were added for a short period of time, and they were to expire at the end of this year because that's when the Democrats wanted them to expire. And so that's where we find ourselves today. Now, the subsidies because they are based upon income, and because prior to the last couple of 3 years where we've seen per capita incomes in Mississippi rise faster than virtually any other state, we have a large number of people that are under the, and again, these ACA subsidies go up to 400% of the poverty level, I believe. We have a lot of people underneath 400% of the poverty level. We do have a fairly large percentage of our population, something less than 10, but something more than 6 or 7 that are utilizing these subsidies. And so what I would expect to happen is once this Democrat election in New York City is over tomorrow, that the Democrats will hopefully vote to reopen the government, and then there will be serious conversation and discussion as to what those subsidies look like going forward. I don't know that they're going to look if there's a vote. I think there will be a vote in Congress between now and the end of the year to extend those subsidies at some level. I don't know that it's going to be at exactly the pandemic levels that were put in place a couple of years ago, but I do think that there's probably going to be some support towards that end. That certainly seems to be the case from what I am hearing in Washington, but we'll just have to see. Yes, Ross.
From an ag perspective, and I don't know that there's anything the state can really do about it, but farmers are really struggling with soybean prices, and I know that President Trump has been in negotiations with China and other places. Is there any outlook from your perspective to help these folks throughout, speaking of rural Mississippi?
Yeah, no, I think it's a very good question, and it's a very valid question, and I think I want to be as clear as I can be. The agriculture community in our state is struggling, and they're struggling for a lot of different reasons, but there's no question that China buying less soybeans hurts soybean farmers in America, and we plant a lot of acres of soybeans in Mississippi. So two things are happening at the same time. The President and Secretary Rollins announced last week about a $10 billion fund that they were working towards to get approved to provide some help for farmers, while at the same time it is being reported that in the meeting that the President had in Asia last week with President Xi, that they have the framework of a deal, and in that framework of the deal, China has agreed to buy a significant amount of American soybeans. And so I think the combination of those two things certainly could go a long way towards helping. Now, the question that I have been asked, and I think it's a valid question as well, is will the Chinese purchases come too late for the 2025 harvest? And I'm not an expert enough to know, and I think for some the answer is probably yes, for some the answer is probably no. We'll just have to see how that plays out in the coming days and weeks.
Some state legislators have expressed kind of concern that they haven't been more involved in the rural health plan. Are there ways that you did involve them in the plan? And to follow up on Shinner's question, will you be making the state's plan public for Mississippians to read?
Yeah, so we've had extensive conversations with legislators and legislative leaders over the last short while, and what you find, and obviously this plan doesn't happen in a vacuum. We've been having conversations with them. I've been having conversations with some of them at least for the last 14 years, and so we know a lot of what they're very interested in. But yes, we've had very, very productive conversations with them just in the last couple of days and weeks, and I think it's fair to say that there's going to be a lot of them are going to be very pleased with the direction that we've gone. And with respect to the plan becoming public, we're going to work with CMS, and we're going to make sure that we adhere to what their framework is and their guidelines are, and really figure out exactly at which point we can make certain pieces of it or all of it completely available. But again, there's a lot of back and forth and dialogue between us and the federal agency that we've got to work through before we can get to that point. So. Well, seeing no other questions, again, I want to thank all of you for being here. Thank you for your questions. Reiterate that an awful lot of work has gone into this in a very short period of time. When you think about literally 100 days, there's been a lot of meetings and a lot of discussions and a lot of work and a lot of people who already had day jobs. They were already doing other things 8 or 10 hours a day to add this on. I couldn't be more grateful. I'm proud of the work that Mississippi has put in. I'm proud of the product that we have sent to the feds, and I'm going to be up there some, and I'm going to keep advocating for Mississippi because I do believe, and this conversation has taken place, and I think there's a lot of pride in Mississippi on the unprecedented success we've had from an economic standpoint. There's a lot of pride in Mississippi that in the success that we've had on the education front, and I believe if done right and we continue to work together, 5 years from now we can take a lot of pride in the progress that we've made in the healthcare outcomes standpoint, and that's really what this is all about. So thank y'all, and God bless.